So today I'm going to keep it as brief as I can and I will concentrate on these areas. I'm more than happy to take questions at the end. So let's get started with a brief overview of
Okay,
SATEDA.
that's fine. Thank you.
So SATEDA's approach is to make sure that we keep the woman and her family at the centre of their decision making. Keeping them safe at all times is paramount. We've been working as a domestic abuse charity in Swale for over 10 years, and we're now proud to say that we are Safe Lives accredited. This basically means that we adhere to the highest standards in support service delivery. SATEDA are positioned as local experts in domestic abuse, and using our experience and specialist women's sector links, it informs our practices, and with this we can develop services that clients really need and want. At SATEDA, we have created a unique journey of support. This has been developed using the views of those that we have supported, women's sector expertise and academic learning from our Chief Exec, Dr. Lisa Thompson. The journey now has a number of specialist programs which can be accessed flexibly in line with the client needs. So for example, counselling can be accessed by someone just starting to understand that they are in an abusive relationship, who need help to find their self-worth in order to access support and then find their freedom. Or alternatively, counselling can be accessed by someone who has been free from abuse for years, but only now feels ready to work through the trauma that they experienced. So on to our grant. So thank you very much to Orchard Community Energy for providing us with a £3,000 grant towards our counselling service. At the start of the grant period, we'd planned to deliver counselling to 60 clients across the Swale area, utilising a combination of fully qualified and placement counsellors. And then came in the COVID factor. The coronavirus changed many things for us at SATEDA. Our staff and team are mobilised to work from home, and many of our volunteer roles disappeared. So when looking at delivering our counselling services, we were faced with a number of challenges. Firstly, the increased risk to clients. Secondly, how to deliver a safe service for both counsellors and clients. And then thirdly, how on earth would we manage it? As with any great challenge, we sought to overcome it. As the project lead, I decided that we would not rush into making poor choices that could negatively affect the clients or the programme. The priority was to establish if there was a way that the service could operate safely, and the first steps were to nurture our team. Many of our counsellors have caring responsibilities of their own to consider and needed the interaction of our team to help them with their growth and development as counsellors. And like for us all, COVID brought around personal levels of uncertainty. Although I did remain optimistic for quite a while that the schools would go back after Easter. How wrong was I? So I started by bringing the team together. I'm supported by an administrator and a volunteer coordinator who are amazing at making the day-to-day happen. Together, we introduced Zoom meetings weekly and were able to make a plan. Clients were phoned and updated on our position and reassured that we were working to find a solution to deliver their sessions. We also make sure they had crisis line contact numbers just in case they needed them. We also work with our counselling supervisor, the counsellors' colleges and the BACP to bring together the changes to the project delivery that ensured it was safe as it could be. This resulted in SATEDA spot purchasing training that was written specifically for the counsellors to work remotely and with clients that have faced domestic abuse. I led the reworking of our policies and procedures for delivery, which meant the utilisation of mobile technology, and clients and counsellors were able to work together in their own homes. In what might seem like divine intervention, SATEDA were then approached by a local counselling company. They also had to stop delivery to their clients, who were mainly working through schools. And this meant that they were able to offer the services of their counsellors to help meet the demand of our waiting list. The organisation had secured some funding, and this was transferable to service our clients. This has been of great benefit to SATEDA's clients, who would otherwise have been waiting for a long time. It also enabled us to pass over more complex cases that were waiting for a counsellor with higher skill level. We're really proud of what we've been able to achieve. During this grant period, we have worked with 6 different counsellors in-house and managed to access 5 different venues, which enables clients to have a choice of locality for their sessions. Working with vulnerable clients brings many challenges for a counselling service. We find often clients aren't ready to engage with counsellors and fail to meet appointments or drop off once the can of worms is opened. In addition, some of the referrals we received have needed to be parked due to accessibility issues during lockdown. We find that victims of abuse often present with complex cases that need additional time to work with before the client can move forward with their lives. So when we look at our delivery results, you can see that we've managed to achieve a whopping 324 hours of counselling delivery time, and we've worked with a total of 72 clients, 59 of those who went on to receive regular sessions and complete a period of counselling. So we've had a look at the quantitative data. Now let's look at the client outcomes. At the start and at the completion of a block of counselling, we ask the client to complete a set of questions. This helps us to see their perspective on the progress that they have made as a result of counselling. From these outcomes, we can see that 100% of clients report to us as feeling less stressed and more motivated as a result of receiving counselling. 92% felt happier and 67% had improved health. Our counsellors also provide us with summative information. This is really a good way of us seeing the client journey and shows their perspective on how far a client has come as a result of receiving counselling. So I've been privileged to be able to share our outcomes with you, but I think it's really important that we hear from those who we help the most. Maria, who's one of our most established counsellors, has asked her client CJ if she can share this story with us. My counselling sessions with Maria have been life-changing. I've previously experienced a dark past which has haunted me for many years. I managed to bury it and continue to have a normal to okay life. The biggest issue that I've had over the years is that I've never dealt with my past. When things are going good for me, my lack of confidence and very low self-worth and guilt keeps holding me back from being the best I can for my family and work life. After my first session with Maria, I left feeling like I'd met someone who finally gets me, as I'd struggled to connect with previous counsellors, and I left my session feeling like I'd been whinging on. Maria is a kind and professional lady who made me feel safe and secure. Maria got me to understand that all of the negative thoughts were not me going mad, and we worked through my issues weekly, and I'm very grateful to have met her. Thank you, CJ. Now we're going to hear from Nicole.
Hi, my name's Nicole. I'm one of the volunteer counsellors with SATEDA. I've been working remotely now for the last few months, and speaking to my clients, and I just want to let you know how they're finding the service that we're offering. They're really, really appreciative of the fact that SATEDA have managed to adapt our counselling services so they can still speak to somebody, especially during lockdown where there's heightened feelings of isolation and feelings of alone are really coming to the forefront at the moment for my clients. And the fact that they know there's someone safe that they can speak to either at the end of the telephone or online has been a real lifeline for them. And it's been invaluable for the fact for their mental well-being during this time. And for me personally, I've had some extra training with SATEDA, which has been really helpful for me, just so that I know I'm offering a service that is safe and is helpful to my clients in the best way possible. We all want to offer the best service we can, because it's so important at the moment out there for survivors of domestic abuse. And for me personally, with the training and also my continued supervision that I've had with SATEDA has been really beneficial for me. And I just feel the service that we're offering now is just going to continue to grow, and hopefully people can see all the good work that we're trying to do out there, and it is so appreciated by our clients. I spoke to a lady this morning that is you know, flourishing from the first time I spoke to her. It's really beautiful to see her develop, and we wouldn't have been able to do that without the service continuing during lockdown. So yeah, it's really working wonders out there. So thank you for listening. Bye.
And finally, a few words from Aisha, one of our counsellors. It has been great to be able to adapt our counselling delivery to work online during the pandemic. Being able to offer 12 sessions means clients are able to take the first steps towards exploring and processing their abandoned feelings and emotion. This empowers the client to grow. One of my clients in our last session with me said, "I was existing before and now I've started living. I enjoy being part of the SATEDA counselling team and feel supported, which has allowed me to grow as a counsellor." This has really shown you what benefit the counselling service at SATEDA can make, and this is only possible with the generosity of your grants. Looking to the future, we're really excited about the possibility of growth within this project. We know that domestic abuse doesn't just happen to adults, it's a family issue. And while we plan to still deliver services to adults, we are hoping that we can embed family therapeutic sessions in partnership with the company who has supported during lockdown. We believe that this will make real change that's sustainable for the future.